Hi everybody, I thought I'd make a video about squats. So squats are an exercise that I probably prescribe more than any other exercise put together really. Everybody needs to be able to squat, everybody goes to the loo, so it's a very functional exercise. Squats are close chain exercise as well, so both feet are on the floor generally, should be. So it means that we do the entire posterior chain as well as doing the meaty muscles of the quadriceps as well. And if we do it right, although I'm going to talk about doing a squat right and wrong because I don't actually think there is a wrong way to do a squat, but I'm going to chat to you about that. But if we do it the way in which I'm going to go through it now, we kind of we use our core muscles, so it's a bit of a core exercise and therefore our back is fully supported as well. So there is really no wrong way to squat. As long as you are squatting, it's a great exercise, and if it feels good to do, then do it. However, there are a lot of people, certainly people that I see in clinic, who maybe have hip pain or knee pain or are harbouring a bit of an injury or are rehabilitating from an injury or have maybe lower back pain. And in which case there's lots of pointers that I can give you over how to do a squat the most effectively without hurting any of those bits, because really squat shouldn't hurt. It's an exercise that, yeah, you should be able to feel it, and if you've not done a lot of squats for a while, you could maybe knock out 10, 20, 30 slow ones, and the day after you might feel some muscles aching, and that's perfectly normal because that's you using muscles that you perhaps haven't used as much recently. However, when you are actually doing this squat, there shouldn't be any shooting pain at all. It's going to be difficult, especially if we hold it for a little while, which is how I generally teach squats as well. We do it nice and slow and then maybe power up as we come out of the squat. So I'm gonna do it and I'm gonna talk through it because I think this is probably a really useful video to signpost people to. So okay, it's not the prettiest, yeah, so I'm really not asked about what I look like, so it's not the prettiest. But it doesn't really matter. What matters is that you are doing it, because it is a wonderful, wonderful exercise. It does pretty much every muscle of the legs. It does the butt cheeks, which are so important. Bleat on about the butt cheeks a lot. And if we turn our feet out to kind of 5 to 1 and 10 to 2, we're actually getting our adductor muscles as well, which again, if you've watched any of my videos, if you're any of my patients, and if you've come to any of my yoga classes, I am obsessed with the adductor muscles. So, really important, if we're going to do the squat the way that I do it, that we set ourselves up from the ground up. So, I usually have quite a wide base of support. That's actually easier for a lot of people as well. So some people like to squat quite narrow because they're a bit worried. You've got a smaller base of support and actually it feels a little bit more precarious. So get your squat quite wide, get your feet quite wide. 5 to 1 or 10 to 2 means that there's less strain going through the knee joints. So that's really quite important as well. Also, ultimately, our knees should be stacked above our ankles when we're squatting, and that shouldn't really change. That stack-up shouldn't really change. It might come over a little, but it should still be stacked above the ankle, because ultimately in this squat, our bum is going back, and our lower limbs, as in the lower part of the lower limbs, are staying exactly where they are. So we'll go through it bit by bit. First of all, the way I like to teach people with regards to their core is to tilt the pelvis ever so slightly to start with. So I'll show you that from the side. So we've got a really rounded out back, we've got a really tucked in back. We kind of want to be somewhere in the middle, yeah? So we've got a nice curvature in the lower part of the back, quite a normal, natural curvature, but we're not going too far one way or too far the other way. We are also switching on our core muscles. What that means is just imagining that you are drawing the belly button towards the spine. So you've just got a little bit of connection, and that really engages transverse ab as well. And then we want our pelvic floor switched on too. So if we imagine that we are stopping ourselves from having a wee mid-flow, whoop, and sucking everything in, then we've got our pelvic floor switched on as well. Now, muscles work in pairs, so the pair of the core muscles are the back muscles. So if you've got some nice juicy core support at the front, it means that your back muscles are supported at the back. So really a squat shouldn't hurt. Okay, so we've got that bit, we've got ourselves set up. Now, in order to get into our squat, we want to be thinking about our weight. It should be equally distributed between left foot and right foot. We almost want to curl our toes a little in our shoes, because that forces the weight into our heels, which is really where we want to be powering up and powering down from when we're squatting, because we really get more gluteal engagement that way. So ultimately all I'm doing is, when I'm squatting, is I'm pushing my bum back as if I'm going to take a dump on a really nasty toilet and don't want to touch the seat. And I'm making sure that my knees are over my ankles and the chest is up, so the back is really quite straight. So if I did this from the side, as I go down into the squat, my back is fairly straight, fairly flat. And as you can see, my knees are directly over my ankles. So they're not coming over like this, because that can place strain on the ankles and the knees. We're just pushing that bum all the way back. Now, how far you go is entirely up to you, and it depends how comfortable that feels. If you want a little bit of a guide, we can use our trusty seat, and we can always do a little kiss on the seat. So we can sit into our squat position to start with, with our knees nice and wide, especially if you're new to squatting, and you can come up and you can do a sit to stand that way. Touch the seat and then power back up. Touching the seat, powering back up. Now, a little bit more about the squat. So we're in our squat position. Ideally what should be happening is, once we've got all our setup going, it doesn't really matter where the arms are. I quite like to have my arms out wide or out in front of me or across my chest, but I'm breathing in as I go down. I'm going to hold it there for a few seconds. I'm going to try and even myself up, and as I breathe out, I'm going to push through my heels and all the way up to the top. Maybe a little push at the very top as well, so you're getting a little bit of hip flexor engagement. And then as we breathe in, we go down. We've got our core control on, we've got our pelvic floor on, we're distributing the weight. We can stay here for a good while if we want to, and then we can come up nice and slowly, or you can power up. Ideally, the slower you go into a squat and the slower you come out of a squat, the better, because we have a lot more muscle engagement when we're taking our time and allowing those muscles to really get engaged. So that's a squat. That's the way that I squat. When you're coming out of it, if you're putting the weight through the heels as well, it kind of gets more of the posterior chain, and it also helps a little bit with balance, so with proprioception too. So if we've got any kind of issues, if we've had any lower limb injuries, sometimes our proprioceptive fibres aren't really kicking as much as we would like them to. Sometimes if we've had an injury, we might find we're a bit more clumsy or a bit more stumbly. So when we put our weight in the heels, it kind of challenges the proprioception a little bit more. If we're doing it at home and we haven't got any weights, squatting barefoot is really good as well. You get even more proprioceptive input there. So that's it really. Like I say, there's no right or wrong way to squat. But if you're a little bit nervous about a squat because of either back, knees or hips, as long as you've had everything checked out, yeah, because I can't take any responsibility for anybody spannering themselves up with this, but as long as you've had everything checked out, and there's no reason why you shouldn't squat, then this is actually a really, really safe, easy and very effective way to get some squats in. How many you do is up to you. I usually do 25 nice slow ones in the morning and 25 nice slow ones in an evening. So if you start, then I'd like to think you're cracking walnuts by Christmas. Take good care everyone. Thank you.